Well, good afternoon, Tom Ogg and Bob Pritchard. Thank you for your willingness to jump on a call today. It's really great to be able to just spend some time with you and really talk through the service of Best Upon Request at St. Elizabeth Physicians and the work that we're doing with in partnership with you, Bob, as the CEO of St. Elizabeth. So I want to jump right in, but I'd like to make some introductions. Again, my name is Bill Mills for the viewer. I'm the president and COO of Best Upon Request, concierge service company located here in Cincinnati, but with a national reach. And I want to introduce Tom Ogg. Tom is the founder and president of Development Partners in Healthcare. Tom, you've spent the better part of the last 25 years partnering with healthcare organizations and physician groups, and with folks like Dr. Bob Pritchard here with us today. And St. Elizabeth Physicians has been a long-term client of yours. And so I'm proud, Tom, that you've joined us. And then Dr. Robert Bob Pritchard, he is the Chief Executive Officer of St. Elizabeth Physicians, an organization of 600 plus physicians and APPs. And Bob, you're in a unique role because you're the CEO of St. Elizabeth Physicians, and you're also the Chief Clinical Integration Officer of St. Elizabeth Healthcare. So you kind of have a foot in both organizations, a large hospital system with multiple hospitals, and then the physician organization that supports all those hospitals. And so we're just really proud to be your partner, and we're thankful to have the opportunity to speak to you today. As we jump into the conversation, I want to invite Tom to go first. Tom, you and Bob have known each other for many years. You have worked with St. Elizabeth Physicians. You've worked to support Bob and his predecessors in this role. And so I'd love for you to just begin the conversation today, share your why. And the why is why you're partnering with Best Upon Request to spread the word about what we do and why you're excited about helping make connections for us.
Well, Bill, I'd be glad to. It's my privilege to participate in a call, especially with Dr. Bob Pritchard, who I guess it's 25 years we've known each other through previous organizations. And so it's wonderful to be with him because of the credibility that he brings to everything that he does. So this is a wonderful pleasure for me to be participating today. In terms of the why, Bill, you know, it's hard to believe I'm celebrating my 40th year in healthcare, which is hard to believe and hard to imagine. I know I don't look that old on camera, but I am old enough to have been in this profession that long. And that 40 years in healthcare has been primarily working with physicians. I do work with health systems, but my primary client has always been physicians, whether they are independent, whether they are affiliated with a health system or merging with another physician group. That's been my role in working with physicians over all those years. In a variety of roles, I was a group practice administrator for a number of years. I was a director of information systems and billing for a large academic medical center for several years. But the last 23 years, I've had my own firm in helping physician group practices improve their clinical and financial performance through planning and data analysis and leadership development. And so that's what we've been up to the last 23 years. But over the 40 years that I've been in business in healthcare, I've witnessed over that time just a very high level of increased complexity among physician groups and how they conduct themselves. Going way back, and I won't go through the whole history, but managed care came into play, and that was a big change for my clients. Then government regulations ramped up, in which all things that they had to begin to do for quality measures and things of that nature became a difficult task and transition for them. And then the EMR came along, and the frustrations with physicians having to learn how to use various aspects of the EMR to provide better care for their patients was a unique stressor for them also. And then, of course, more recently, the pandemic that has come along. So that complexity over all these years with my clients has resulted in just incredible levels of stress on them, both as individuals, both as corporations, in doing what it is that they were called to do in the healthcare profession. And over the last several years, as I stay and try to read up on things, the burnout level among physicians has reached epidemic's a word that's thrown around too much, but over 50% of our providers and that would include mid-level providers as well as MDs and DOs, are burned out to a certain degree. And this burnout has really increased the suffering that they have and harming both their mental well-being as well as their physical well-being, their ability to function at the very highest level and to concentrate on what they do, and also, most importantly, their impact on their family life. All these things have contributed to them having a very, very stressful time in their lives when healthcare was stressful to begin with. Just the pressure of taking care of and that privilege of taking care of an individual, and then you layer on all the things that happened over the last several years. My clients are stressed and they are having very, very difficult time. So I've begun looking several years ago for how could I, as a firm, how could we help physicians address that in some constructive way. And frankly, some of the solutions that we've seen really miss the mark. They deal with things like, let's get people together more socially and let's revive the spirit of the organization, or let's even do a retreat on a weekend to help them become more resilient. And things like that they miss the mark simply because what physicians want is time. They don't want to spend more time at work or more time what they're trying to accomplish. They want to get home. They want to get with their families. They want to be able to have a life, somewhat of a life outside of their professional obligations. So I continued my quest for finding something, and late in 2020, your firm, Bill, Best Upon Request, sent me the data that they had gathered during their surveying of their physician clients during the 2020 year, which again was a very difficult year for the pandemic. And I was just blown away by the statistics that your company reported. I always kid with my physicians, we do strategic planning, we can't get two of you to agree on anything, but your data showed well over 95% in several critical areas where physicians were agreeing that your service provides a reduction in stress, an improved ability to concentrate on their work, buying them additional time so that they can be more present with their families when they get out of work. Over 95% of them feeling more valued by their employer, which again is always a good thing. The stronger they feel the connection to the mission of the organization, the better they're going to contribute to that. So all of those things brought me to the conclusion that I needed to look at your service very carefully, to see how I might be able to bring that service to my clients. And so I made a strategic decision at the end of 2020 that I wanted to partner with Best Upon Request to see if I could introduce what you do to my clients so that they could reap some of the benefits and this mitigation of burnout and stress that you're reporting on with your other clients. And so that's been my mission, to help bring what you guys do to my clients and to help you increase your footprint among physician group practices. And so that's my why. And I just am very proud to be associated with Best Upon Request at this time.
Thank you for that, Tom. That was pretty awesome. Bob, you are a partner with Best. You've partnered with Tom for many years. Hadn't really planned to ask this, but based on what he just said, can you just reflect on your relationship with Tom, and the years that he served you and some of the work he's done with you?
Yeah, I mean, Tom said, I was trying to remember when we actually met, but our paths probably started crossing in the late 90s, and found Tom to be a real asset when it came to working with physicians and groups sort of strategically. And you think about a large group like ours, or where I was many years ago when Tom and I first met, you've got the big group, but you have all these subcomponents. So is it just working with the GI division or with the cardiology division? So I don't want people to lose focus on, you can focus more narrowly on all these microcultures you have within your group, and as you're building a larger culture. So Tom and I have continued, when we get in a tough situation, I pick up the phone and call Tom and say, hey, Tom, what do you think about this? Is this something you can maybe help us work with these folks to, as Tom said, you can't get two people to agree on the same thing in strategic planning, but Tom does a darn good job of trying to coalesce those ideas. I try to advise young physician leaders that every physician has the right idea on how to fix things. It's just they all have the different idea on how they should be fixed. And so how you try to bring that together, and Tom really does a masterful job in trying to coalesce those thoughts and support each individual in those discussions, which is, I think, is a real talent.
That's awesome. It's kind of like a word that comes to mind based on what you described. Tom's a synthesizer. He's bringing great ideas together to make one. And and so that's been our experience in partnering with him, and it's just been, you can tell we knew Tom, but in our work with him over the last few months, it's been extraordinary just listening to him talk about history and what he does, and it's just really exciting to see. Tom, this isn't what you deliver on, but you're passionate about physicians, you're passionate about physician leadership and healthcare leadership, and your partnership with us is really all about, you're just bringing another solution. You're not delivering on the solution, but you're helping bring it, and we couldn't be more grateful and more happy to have the partnership with you. Bob, let's transition to you. I mean, you're the chief clinical integration officer of a health system with multiple hospitals. You're the CEO of a large physician practice that supports those hospitals. I want to guess, though, that, I mean, you're a physician. And so I'm thinking that you bring a perspective on physicians first, and that influences how you lead a team of physicians, and it influences how you go about your work at the health system level. I'd love for you to just talk about your two roles and how you approach that, and just sort of what ultimately it's your responsibility to accomplish.
Yeah, I mean, specifically, I sort of laugh at my boss when he tried to come up with the longest title he could come up with, Chief Clinical Integration Officer, because I lobbied for Chief Clinical Officer, and they thought that integration part was so important, and it ended up really being important. What we saw as an organization, the larger St. Elizabeth, was at St. Elizabeth Healthcare, our hospital side of the organization, and our St. Elizabeth Physicians Group were not growing together; they were actually growing apart. And as those two organizations were sort of growing apart, it was also splintering our independent medical staff, because it felt like the competition was tough between the employed and the independent groups, and it spread. It goes down the path to nursing or other administrative folks within the organization. And so when I was asked to take this new job, the least important word in the title ended up being the most important part of the title, and that was integration. And how do I get these folks to end up coming back together and work together? And I think for me, the key has always been respect. And I try to honor all physicians, no matter their role, their relationship to the organization, or even outside the organization, is that I think I do understand what many of them went through to get, and I'm not a surgeon, and so I didn't go through the same training a surgeon did, or I'm not a gastroenterologist, I'm a family doc, but I think we have a basic understanding of what all of us went through to sort of get to where we are. And so I try to always honor that and try to respect that and try to make sure my other colleagues in leadership understand and respect that. And so I think that's sort of the key of what I was asked to do when I took this new role on about 6 years ago.
Do you find yourself switching hats from day to day, or is it kind of one hat, the system role versus the CEO role?
At this stage, it's sort of become one hat for me, but I think that I say this all the time, that a physician leader always seems to have to straddle the fence between the organization and the physician group, the hospital organization, the physician group, and probably if you're doing a good job, all of them probably think you're a little bit of a pain in the tail end, because you're trying to bring both groups along together, and their individual goals may not always be completely aligned. And so how do you do that? So I think that I've been doing this long enough and on the leadership side now for 22 years, 23 years, that it feels more like the same hat all the time, but it does get a little frustrating at times when I'll say one side of the street doesn't understand what's going on the other side of the street.
Well, that's a really good answer. And I would venture to imagine that when you decided 4 years ago to reach out to Best Upon Request, I would imagine you were thinking with both hats on. I mean, let's face it, your team of 600 plus physicians, in large part, they determine the hospital's revenue. In large part, they determine the patient experience. In large part, they determine the overall success of the system. And so, taking care of their well-being and providing for some of the needs that Tom mentioned earlier, must have been, part of what you were thinking about. But I think I'm guessing you were thinking about both the hospital's needs, the system's needs, as well as the individual physician's needs. But I'd love for you to talk about what was on your mind when you reached out to Best Upon Request so long ago.
There's probably so many things I could say, but I'd heard about Best Upon Request, and it was 2017, and I'd stepped into my role at the beginning of 2016, interim in the middle of 2015, full time in 2016, and I think culture is such an important part, and I believe cultures will either happen just spontaneously, the culture will develop, or you can try to proactively try to help develop a culture. And so we actually had a retreat in 2017 where I brought the leadership of the group together, and we asked basically a question: is what do we want St. Elizabeth Physicians to be known for? When you are recruiting a new partner, what are you going to be proud to tell them about St. Elizabeth Physicians? When you talk to your colleagues in the hospital, why should you be proud to be a part of this group? We shouldn't be just an employment arm. And part of the issue that I struggle with today with our physician group, and I can't imagine that others are that dissimilar, is trying to get our physicians to understand that they are, but they're not employees of St. Elizabeth Physicians. They are St. Elizabeth Physicians. They are St. Elizabeth Healthcare. Without a strong physician group or strong medical staff, you don't have a healthcare system. And so it's always interesting when they question, well, what's the health system done for me lately? I always say, but you are it. And without you, nothing else occurs. So that's been an interesting part. But we had that retreat, and we said, what do we want to be known for? And I attribute a lot of this to my physician leaders in the group, or our physician leaders in the group, and a couple of them in particular. But one of them, who runs our surgical division, said, I like, we're trying to come up with a tagline. We had our mission, we had our vision, and we had this sense that the group had really been built, and this isn't meant to be a bad thing, that the patients are at the center of everything we do. And the docs sort of said, you've forgotten about us. What about us? It can't all be about the patient. Yeah, we want to take care of those patients, but what are you doing to care for us? And so we developed a tagline, greatly driven by Dr. Murley at the time. And I'm looking up at the wall because it hangs on my wall here, and it says, caring for our patients, caring for each other. Mm. And so we came out of that and said, really embrace that concept of the quadruple aim, that fourth component of it, and how are we going to take care of our physicians and providers, and all of our caregivers, and we all are caregivers. And we started changing how we did things, and be it from how we held meetings to just any number of things. And out of that came our decision to speak to you all about Best Upon Request. It was just one arrow in the quiver, but how do we make sure our physicians and providers know they're valued, that their time is not only important to them, but important to us? Their longevity with our group is very important. We don't recruit them to come in and be frustrated and leave in 2 to 3 years. I tell folks when I interview them, it's my every expectation that you will be here the next 25 or 30 years. So let's make sure we're doing this correctly. And so I think that's really what drove us to give you all a call and say, can you all play a part in this?
Yep. And of course, the rest is history. We've been partnered now for about 4 years. So let's fast forward to today, looking back, talk about, was it a good decision, and have we helped you accomplish the goal of
Well,
changing the culture, driving ownership, and caring for your physicians?
I think simply the answer is yes, but I think a little bit of the decision making at the time, it wasn't an easy decision. I remember the chair of our board, a physician, a meds peds doc, said this is one of the silliest things you could ever do. Why would you do this? They saw it almost more as a gimmick than as reality and something that could really help. People looked at the cost and said, well, how are you going to spend that much money? How can you justify those dollars? And when you look at the dollars you spend on physician compensation, and for a group like ours, and you break this down over the group, and you think, well, I'm investing about $500 per physician per provider to have this service. That's nothing. I mean, it's such a small investment. And I go back to that gentleman who was chair of our board who thought this was just not a good thing, and he would not use it. And then all of a sudden he got into an issue where he needed help and he didn't know what he was going to do. Actually, it was his son's car had an issue. He had to pick up a part somewhere and get it somewhere else. He was busy, and he said, "Oh crap! I guess I'll call Best Upon Request." And he fell in love. I mean, he started telling his partners. He had a young partner who's had like 2 or 3 kids at home. Her husband traveled in his job, and she was talking about how frustrated it was to get to the grocery store and get groceries, or to have a meal on the table when she got home in time for the kids. And he said, "Why don't you call Best?" And it just snowballs from things like that. You hear the stories, and you've had the stories. We all smile. We had the doc who had you all plan a wedding for her sister because she had committed to help her sister plan her wedding, was going to have it in her backyard, and all of a sudden she got overwhelmed as a surgeon and couldn't set up to have the tables delivered, the caterer set up, and all this stuff. And she just called you all and said, "Please help," and you did it. So it's really been a remarkable thing. I think 20 slowed us down a little bit. I wish, because typically, as you know, Bill and Tom, we will get you to come to our all provider meetings. You all will set up a table at our meetings so you can meet docs and APPs, and that really stopped in 2020. So we don't have. We've got about half of our physicians and providers that engage with you all actively. I wish it was 100%, because I think for those who do use it, it can be a lifesaver. It really can.
Well, it's to your point, it's for everyone. We hope and believe it's one urgent need away to use it, the first time, and then once you've used the service a couple of times, and you see how high the level of trust is with the concierges, because they're dedicated to St. Elizabeth physicians. It's not somebody different every day. And I wanted to go back. You mentioned gimmick, and I think that's a fair question for anyone to ask, especially a skeptic to ask. But what we find in the marketplace is there are lots of gimmicks that are out there, really at a lesser price point than concierge services provided by Best Upon Request, but they're very gimmicky. And a lot of times it has to do with jump on this mobile app or use this piece of technology. And we certainly use technology to the fullest extent we believe possible. But physicians need a high touch. They're not looking for something else to figure out and another password to update to be able to access something on a mobile app. And so the idea that this is real, and you all have said this word a couple of times, I was kind of saving it, but it's the idea, this is a time play. You gave your physicians time when you partnered with Best. And Tom, you said it in 2 or 3 different ways, but it's this idea of you giving time back. One of your physicians, Bob, and I may have shared this story with you before, but I was on the phone with her. I've had the opportunity to interview many of your physicians, and this particular was one of the very first ones. She was on her day off, and she was so excited to be talking about Best Upon Request and how she uses the service. And I was thinking, she's going to give me 5 minutes. She's on her day off. I can hear kids in the background. She was so excited she couldn't even catch her breath, just wanting to talk about all the different ways she uses the service. But the one is so profound. I bet I've told this story 50 times. She said, "Listen, I have 4 kids and I have a newborn, and I made the decision to breastfeed my newborn. And the one thing that probably drives, and I may be paraphrasing a little bit here, but what I heard her say is the thing that drives burnout for me is when I have to make compromises, when my family is compromised, when my personal commitments are compromised. And she said, it's not unusual for me to be at the end of my workday expecting to go home and feed my baby and to get a call that I've got a baby to deliver at the hospital. And the first thing I do is I call the concierge. They come and get the breast milk that I've been pumping today, and they take it to my husband so that my baby is fed dinner on time. Your service, St. Elizabeth providing this service to me, allows me to keep my health commitments to my own family and to my own child. And when she said that it was like drop the mic, that's all I need to hear. I am all in for every physician we can serve from now on, because we are helping your folks not to compromise their personal families in the process of serving other people.
Well, and I hate to say this, but not everything is completely altruistic. I mean, I hear that. The other part of, she's able to stay in the office and see patients.
Mm. Yeah.
So as the head of her physician group, it's important that we can keep people in the office. We had one bill that I thought was interesting. One of our providers, one of our physicians whose mother was elderly and looked like was having early signs of dementia, and her mother lived, I think, 4 or 5 hours away from here. And this physician was sort of overwhelmed. She said, I need to go up to my hometown and research assisted and independent living facilities. And for some reason, she got the idea to call you guys. And she said, Bob, you wouldn't have believed it. He said, they gave me a list of every facility in the area, all the highlights of each one, and said, so just help me to do the legwork so she could then narrow it down and more focus her visit when she did go to her hometown to try to get that done. And so you just think of lifting that burden that just puts that extra stress or pressure on you, be it either making sure your kids are taken care of, or your mother's taken care of, or whatever.
Hey, Bob, can I go back to your retreat from 2017? Because I love the tagline you all initiated at that time. Has your organization, your physician group, made the connection between best upon request and that we're being cared for, we're caring for each other? Is that connection evident to them through your experience or not?
I think it is. It's hard for me to say that particularly. We're going to be interesting. We have a little retreat every year, but that was a big one in 17. We're having the follow-up to the big retreat this year.
Okay.
And we're going to ask the same question. Mm-hmm. What do we want to be known for? Yep. And it's interesting is, as physicians, we went through this exercise. I'm not sure this really has anything to do with this discussion, but we ask our doctors, our physician leadership, what are the simple truths of our group? And I was disappointed in that our group only came out with one simple truth that described our group in 2017, and that was, we work really hard.
Yeah.
Wow.
And so we're having this follow-up in July. It was supposed to have been last month, but COVID has still got us not getting together, so we're hoping we can get face-to-face in July, and we're going to ask this question again, and we're going to go through that simple truth exercise again. And if the only thing comes out this time is that we work really, really hard, I'm going to feel like I've been an absolute failure. Because I really do believe, well, we've seen our physician engagement scores have gone up over those 4 years. We're a top quartile or higher group as it comes to engagement. Well, this year we hit the trifecta. We were in the top quartile on provider engagement, patient engagement, satisfaction, and associate engagement. So we've seen all of those things grow over the last 4 years. Now, does best upon request drive that? I don't know if they drive it, but they're a major component of that message we were trying to send, because I used to be confused that we would have low physician engagement scores, high associate, patients were, and I thought, shouldn't those all be aligned? If we're doing our job, shouldn't they all be traveling together? And they are now. Right. So I think it plays a part in that.
Mm-hmm. Good.
That's really good. I want to go back your point about that's not all altruistic, and the idea of keeping the doctors focused and productive at work and having them able to focus on work at work is important for everybody, but especially for physicians. And it's important for the patient experience. It's important for their practice and their effectiveness in their practice. But when I had the opportunity to interview some of your other physicians, and I want to give you a word of affirmation here, over and over again, I heard this voice, this sentiment, if you will, and one person said it very, very specifically, but several hinted to me this idea that they're listening. When I was asking questions about, tell me how you're using Best Upon Request and what are you using us for and how is that helping you? Are we part of, Tom touched on some of these, are we part of your personal wellness plan? Are we part of your ability to spend more time with your family and some of those kinds of questions? When I ask a question, if you could send a message by me to your leadership, if there's one thing you would share with them, what is it? And several people touched on this, but one said it so specifically, they're listening. They're listening. I think when July comes around, you're going to hear that you've listened and you've done well. Of course, that's coming from Best Upon Request, of course, but I heard it from the horse's mouth. They literally said to me, they're listening. The other piece, the productivity piece, I had multiple physicians tell me that they were able to carry full-time loads when otherwise they would not, because they have kids and busy homes and demanding jobs. They told me they would not be able to work full-time were it not for this service. And so you probably haven't gone off and calculated an ROI beyond physician engagement, beyond physician sentiment, beyond your culture metrics and knowing that things are going in the right direction. And again, those three things you talked about aligning, those are aligning. And so your mission, your ROI, I hope you agree that it's been accomplished as far as you can tell so far. But I can tell you that if you endeavored to reach out to the 50% of physicians who are using the service and ask them, have you been able to work more hours? Have you been able to not cancel appointments because you had access to a service like Best? You're gonna find out that a lot of them would agree with that because they told me. I was not fishing. I was just asking questions about what's the service done for you. And I had multiple say, I've canceled less appointments in the last 2 years that I've been using this service than you could imagine. And I had one physician say to me, I was 3 days a week. I was able to go full time because of this service. She and her husband are physicians. They're very busy. And she said, my patients, she works in mental health. She said, my patients need continuity that beyond what I was able to provide for them. But I'm now able to work full time solely because of your service. And so I think there's an ROI far beyond engagement and culture and just driving ownership and getting those key organizational metrics to align. But I was so excited to hear, your physicians saying those kinds of things. They're listening. And,
Well, when I took over this role, I'm glad to hear you say that because I heard a lot of folks say that nobody listens to us and they're not hearing our message and our concerns and that they worked, our physicians and providers worked for the corporation instead of the corporation working for them. And so one of the big things we've said is that our job as the leadership and as the support staff is to make our physicians successful. And if we have successful physicians, I think everything flows downhill or maybe uphill, whichever way on this one, but the health system will be more successful. Our patients will be more satisfied because we want those docs engaged and happy to be here. I once had a consultant who worked with me, not Tom, but another guy who would say that many physicians feel like they're trapped in resentful bondage.
wow.
And I don't think he was wrong. And so our job is to move them out of that feeling like they're caught. And we're not, when I look at the three of us here and our graying hair and things. Physicians in the practice of medicine are so different, and Tom alluded to this, so different today than what it was when I started. And people are looking for different things. And that I tell the story, I tell this to almost every recruit I meet because I can't help it. But I can remember when I first started doing this, if within the first 5 minutes a physician interviewing with me would ask me about work-life balance, I'd say, we don't want this physician in our group. Now, if within the first 5 minutes I don't talk to them about work-life balance, they don't want to be a part of us.
Wow.
And we actually talk about best upon request in our recruitment as something that sort of sets us apart from potentially other groups. This is part of, hey, has anybody talked to you yet about best upon request? They say, oh, what are you talking about? Well, we have this concierge service. Oh, yeah, somebody else mentioned that. They just didn't mention the name. That's pretty neat. It is a differentiator, I think, when it comes to physician recruitment. I don't think
Bob, if I could make a suggestion for your next retreat, is that sometimes when you're trying to change culture in an organization, you need to connect the dots a little bit. So we said in 2017 we wanted to care better for each other. Here's one of the things we've done along those lines to care for each other better, and that's best upon request. Now, I'm sure you've done other things as well, and that's certainly not the only thing, but sometimes people don't connect the dots to say, oh, yeah, this is about what we talked about before. I think you got a great opportunity to do that.
Yeah, it's interesting you say that, because as we've planned that retreat, we plan on it. We've talked about it being another cultural retreat, but we plan on the first part of it being an affirmation of what we accomplished since 2017.
Yeah.
Here are the things we heard. Here's our notes from 2017, and here's the things you said you needed.
Right.
Now let's go through those and see what we actually accomplished. So that we plan on being a part of that, to prove, as Bill said, that we actually heard them and have tried to support them. Because it's not all. It's amazing to me is when physicians are interviewing for a job. We did not know what national benchmarks were 35 years ago when we came out of residency training. We had no clue what a work RVU was or what people got paid per work RVU. But when people now come out of their training and they have an expectation of, oh, now what are you going to pay me per work RVU? They know that.
Right.
We all have the same benchmarks.
Yeah.
So it's going to have to be something other than just pay, I think, that says we want you here and we're going to really help to take good care of you while you're here because we want you to be successful.
Great point.
Bob, I had, in those interviews, I had physicians tell me pretty commonly, that they're being recruited. It's clearly a competitive environment when you're talking about very capable physicians. And I had multiple physicians say to me, you get recruited all the time when you do what I do. And I've basically turned that off. I've turned the volume down because, number one, I'm happy at St. Elizabeth, and you all do a couple of really cool things. Your continuing education support and the work you do in that space, I heard that very clearly, by the way. The other thing you do really cool is best upon request. And those are the two things that I heard over and over and over again. And just, again, I didn't really ask the question to get that information, but I just had people telling me over and over, this is one of the reasons I've turned the outside volume off, because I'm not interested in working somewhere else. I actually spoke to one physician who was leaving, and she said, the only reason I'm leaving St. Elizabeth is because I had the opportunity to go to a health system in my hometown out of state, and I need to go home. I've got a young family. I need their support, so I'm going home. And I said, oh, we work with a health system in that city. Does it happen to be fill in the blank? And she goes, oh my gosh, I'm totally joining the wrong health system. I wish I had known that. I would have pursued an opportunity there. So I think you're dead on in your recruitment. And I think, we've looked at a lot of data, physicians who use it and what age cohorts are they in. And I know we provided you with some of that info last year, but I think what we see is that regardless of age, whether you're a millennial and a brand new physician or whether you've been at it for 35 years, everyone has needs that are time-based, and the concierge can support with that. It looks different. if you're 35 or if you're 30 and have young kids, it looks different than what, Bob, you would use. But ultimately, we all have needs because we all have time constraints, and we all have limitations, things that keep us from spending time with our family, spending time maintaining our own health. And this, as was said earlier, this is something that your physicians are using to regain ground in both of those spaces, the wellness space and the family time space. And they also told us 97% said, I'm able to focus more at work when I'm at work because you take all the things off my plate that I don't really need to be worrying about, but they're absolutely worries. As a matter of fact, it just came to my mind. One of your physicians told me, I love this analogy. She said, all the things that come up in my personal life, they're like a pebble in my shoe. It's like an irritant, and it keeps me from going at full pace because I've got an irritant, I've got a pebble stuck in my shoe, and I walk with a slight limp, and I'm always mindful that it's there. When I'm able to offload the pebbles to best upon request, then I have 100% speed and efficiency and focus on what I'm trying to get done. Any thoughts about that analogy? Would you?
I mean, the biggest thing I hear there is they say, and what's that worth? That's the key to me. I think actually it's a small investment when you think of it on a per physician, per provider basis. If it keeps one doctor from leaving, it's probably paid for itself.
Absolutely. Yeah. So with that said, what advice would you leave any healthcare executive, physician group leader who's going to see this video? What advice would you leave them with?
There's so many things we could talk about, but I think it's value your physicians and providers. I think do your best, as I said, to make them successful or help them be successful. I think it'll pay dividends long term. We have a very low turnover of our physicians and providers, and I think this is, as I said, one tool in our toolbox that helps us to accomplish that.
Okay. Well, thank you so much for sharing, and Tom, thank you for joining in. I love your insights into the world of healthcare and physician planning and resourcing, and so it's just really great to spend some time with you all. Tom, any parting thoughts from you?
No, just thank again Bob for his time, and my client, St. Elizabeth Physicians, has been a client of mine, and they are certainly doing all the right things, not just best upon request, but I find as a highly engaged physician group that I think is a competitive advantage for them as a health system, that they do the kinds of things like best upon request and many other things that value their physicians. So I credit Bob and the rest of the administrative team that I know very well at St. Elizabeth for their work. It's just a wonderful, wonderful organization where people are highly engaged. So.
Okay. Well, thank you both again, and we couldn't be more grateful for your time and sharing with our potential clients going forward.
Thank you very much.
Thank you.
Thank you, Bill.